Yesterday, we talked about why we should be aggressively cardioverting patients with recent onset atrial fibrillation presenting to the emergency department. Today, I want to focus on which groups of patients are appropriate for ED cardioversion. We're trying to identify patients who are at low risk for creation of clot in that left atrium, because if you cardiovert those patients, there is the risk of dislodging that clot and creating downstream embolic phenomena. There's really three groups that are going to be appropriate for that management. The first group are patients who are low risk, defined by a CHADS-VASC less than 2 in men, less than 3 in women, with less than 48 hours since onset of symptoms. The second group are going to be patients with less than 12 hours of symptoms who are high risk as defined by CHADS-VASC once again. That's going to be men with a score greater than or equal to 2, women with a score greater than or equal to 3. And the final group are those with any onset time, any risk level, but they have been appropriately anticoagulated for at least 3 weeks. In all these patients that we're cardioverting, we have to consider anticoagulation, and once again, we can use CHADS-VASC to do that risk stratification. In men with a score greater than or equal to 1, and in women with a score greater than or equal to 2, we should be starting the patients on anticoagulation, but these patients can be discharged home with close follow-up. So remember that if you're pursuing ED cardioversion for recent onset atrial fibrillation, we want to keep it limited to those three groups.